Smart healthcare. In recent years, Thailand has actively promoted the development of smart city, continuously investing resources in construction of improving healthcare services and enhancing urban infrastructure. This provides a development opportunity for cooperation between Taiwan and Thailand. Thank you for joining us today. And we are excited to hear from our distinguished speakers as they are sharing their expertise and insights regarding smart healthcare. And we are now going to our speech section. Let's give a warm round of applause to welcome the first speaker of this morning, Dr. Akkarapon Kurusatra, Assistant Director General of Department of Health Service Support, Ministry of Public Health, and Director of the Bureau of Medical Hub Industrial Promotion. Please welcome Dr. Akkarapon Kurusatra.
Swadikap. Hi, morning everyone. I'm Dr. Akkarapon Kurusatra. It's very honored to be here today. So the topic that we talk today is the how to development of the smart care in Thailand. Yes, because we come to the Taiwan is a smart city and smart country also. Please make collaboration together to be about smart hospital together. Okay. Before we start for talking how to make about the smart, we have to know about the situation of the Thailand first. What is the situation of the Thailand? Mostly of the healthcare facility in Thailand, it is very just complicated of the healthcare facility. The first one, it is the left-hand side is the private sector. Private sector, we have about 421 hospital in the private sector around Thailand. 81 of the private sector, they are welcome for international patent that intention to treat in Thailand. It's meanwhile we not serve only for the Thai citizen, we serve for international patent. So it's meanwhile Thailand have the medical tourism index is number 5 of the world. It is the hospital. And about the clinic we have about 34,700 private clinic in Thailand. If compared with the Taiwan have 17,000 clinic around Thailand. But if the population, if compared with Thailand, now population in Thailand is 66 million. And the expat stay in Thailand is about 3 million. And about the workers stay in Thailand is about 5 million. So it is only in the country that we have to serve our system. And the most important role is the Ministry of Public Health. Ministry of Public Health is the major agency that responds for healthcare in Thailand. Mostly the hospital is under the office of permanent secretary. How many that you think? Because we have 76 provinces. So we have about every provinces we have the hospital at the provincial hospital. And after provincial hospital we have district hospital. District hospital may be about 800 district hospital, mostly under the office of permanent secretary. So about the response for the secondary and tertiary care for the office of permanent secretary will be about nearly 1,000 hospital. And go to the sub-district level. Sub-district level about 10,000 sub-district hospital. It is mostly by the Office of Permanent Secretary. This is the government of the system. And other is the department. Department is because not only Ministry of Public Health in Thailand, we have another department. But But the department hospital is the excellent center, just like infectious control department have their infectious control hospital. And another, it is a challenge of the Minister of Higher Education, Science and Research and Innovation. It is a new ministry. It is a new ministry, mostly from the university hospital. And another side is under the Ministry of Defense. Ministry, as in Taiwan also, you have about the under Ministry of Defense. But it is quite the number, maybe about 2 figure of the number. And the last one, after we decentralization of the power to the local ministry, sub-district hospital is governed by Ministry of Interior. So now the sub-district hospital is transferred to the sub-district to the Ministry of Interior, maybe 3,000 hospitals. So you can calculate how many hospitals and the healthcare facilities in Thailand. So how many you can do any aspect. It is the big picture of the healthcare facilities in Thailand that we not serve for only the Thai citizen, we serve for international citizen also. About the digital health developed evolution in Thailand. We developed into the 4 phases of the Thailand. The first one is just like the analog system. It's a paper. In 1980, it is the analog system. And after the second phase, we use about the electronic medical record. It is adoption after 10 years in 1990s. We adopt for about electronic medical record. And now it's go on and go on. And the third step, we try to do about the data we call at that time is the health data center. The first time we call health data center because you know the previous slide, mostly of the hospital and healthcare facility under Ministry of Public Health. So the data center at that time formed the Ministry of Public Health on the majority. And after we will decide to be National Health Data Center. In data center in Thailand, we different from the Taiwan. Taiwan mostly have the data center for the reimbursement system. So you have about only one system. But in Thailand, we have National Health Security Office. It is a reimbursement system. And another one is the big picture of the using facility in Thailand by Ministry of Public Health. So we have to collapse together with that. It is a challenge for us in the future. It is the third phase. And the final one, it is the fourth phase, it's the mobile health. Mobile health is very popular at the COVID era. And now it's continue popular in Thailand also. Because we're not only in the rural area. The rural area in Thailand, we have the challenge for the infrastructure for the 5G or 4G. Not as in Taiwan, you have the infrastructure, it's quite good. But in Thailand, we have the problem in the rural area about that. But the important thing, we have international patent for the follow-up from the private hospital and other to make about telemedicine is quite popular, it's quite now. The background, everyone asked for Minister, why Thailand to be success story for the medical tourism in the world? The background why we success story, because the first step, we have to balance about the health system in the country first. If you treatment for international pattern, you have to respond for in-country safety and equity and equality for the treatment. So the cabinet make decision for the cabinet resolution in 2016, their announcement for the policy for Thailand to be the medical hub of the world. At that time, the first time. And now we have this 20-year strategy of Thailand to working. It is the linkage together after the cabinet meeting. And now they have the cabinet meeting also because at that time, The chairman of the steering committee is the Minister of Health and Minister of Tourism. But this year, the chairman is the Prime Minister to make about Thailand to be a rank of the medical tourism of the world. Now we rank is number 5. We want to be a number 2 in 2 years. So it is the position with Thailand. How the definition of the medical hub? Medical hub in Thailand, we divided into 4 hubs. Not only medical service hub, it's just like the hospital or any private or any clinic. We have the wellness hub also. We have about the products hub also, and we have about the academic hub also. The figure that we calculate from the patient all over the world that fly to treatment in Thailand, we can consumption, we can gain about the benefit to Thailand is 1% of GDP in Thailand, just only the treatment, not include the collateral business. Because one patient, they follow with 3 followers. They will stay in the hotel, they will shopping, they will go to the restaurant, they will go to tourism. So you calculate how much for the medical tourism. It is the pattern. So the data that mostly who is come to Thailand for treatment, who could come, mostly come from the Gulf area. The surprise is that you will surprise the data. The data will not open any address. This is in the first stage that I addressed for the data in 2022. Yes. The data is from the country for Kuwait country. It's number 1. Number 2 is Myanmar. You see? It is quite, it's low quite a population, but this is the number 1 of come to Thailand and spend the money at there. The key point, how to Thailand to be the success story, because in Thailand, we can reimbursement system from any other country. Negotiation is the major duty for government to negotiate with any country to open the key and open the gate to fly to Thailand to treatment. So about the National Health Data Center, is this the data that we can know about how many times to treatment in outpatient and inpatient per day, and we know about the situation. In Thailand, we divided into 13 clusters combined with the 76 provinces. This is the data. We know everything in the National Health Data Center, but it is the challenge for us. But if you want to do about the digital health in Thailand, we have law and regulation. In Thailand, the important acts is 3 acts. Number 1 is Cybersecurity Act. It's on 2019. And number 2, it is the Personal Protection Data Act. It's 2019. And the last one is from the Hospital Act. It is the public health announcement. We announcement about the telemedicine in 2021. So if you do any business, you will follow mostly for the 3 acts. And about teleservice provider, have a lot, maybe about the platform, maybe about any communication channel, we use a lot. But how to negotiate them together and how to make about the action together with the public health announcement, it is a very challenge for us also. How the challenge of the developing digital health system in Thailand. Number 1 is the system governance. In Thailand, majority is the Ministry of Public Health is the major agency to have about the govern of the hospital, public hospital. But how we govern for the other ministry? The data is not come to the Ministry of Public Health. This is true. So we have to decide for the system governance of the data of the agency, national agency that govern of the data at that time. This is the duty of the government. The second point is how to governance of the data. If we have the data already, how to governance about it? Is it a duty for the government to do about that? And the third one, if you think we have many problems about cybersecurity, especially Ministry of Public Health is a major ministry that cybersecurity problem a lot. They attack us a lot of time. If you go to the news last Thai people, we go to the news last day, we have attack also. So if you invest about the cybersecurity is one point that we need for our challenge for us. And the fourth one, telemedicine in Thailand, they're quite popular. It's still popular, not only the time of the COVID, but now it's quite in time of popular also for about the telemedicine. Just we not only in the rural area, but urban area also in the telemedicine, especially follow-up of the patient. And the challenge is number 5, how to development of digital health workforce in Thailand. Because mostly in the hospital, in the public hospital, about the IT man, about the health workforce is not enough. We have to escalate of the number and the knowledge and the sharing and technology transfer about that. This is the challenge for Thailand. And the final thing, number 6, is how to create about medical AI. Medical AI is one of the challenges for us to make. So if you see about the challenge of developing digital health, in Thailand we don't serve only those patients only in Thailand, but we serve international patients all over the world. So it is a duty in the Thailand that is cabinet, and it is a solution for the country to go. Thank you so much.
Thank you, Dr. Akkarapon Kurusatra, for your insightful presentation. And the next speaker will be Dr. Nina Gao, CEO of Overseas Medical Mission Center, Changhua Christian Hospital. Please welcome.
Sawadee. So, good morning, ladies and gentlemen. This is my pleasure to, on behalf of Changhua Christian Hospital, to present what we do in the Thai. So my topic is inclusive partnership, because the partnership not only for one dimension. We hope that partnership with Thai will be in different dimensions. I'm Nina. I'm the CEO of Overseas Medical Mission Center. Sorry, it's quite difficult for me. Can I move here? Can I suggest the organizer next time don't put the speaker in the here? That is very unfriendly for all of the speakers. Okay, so maybe you don't know where is Changhua Christian Hospital. I think most of people, they only know Taipei, right? But our hospital not in Taipei. Taipei is here. So we are in the central area. So the hospital, the rest by is a medical center. So you can see in this big area, only one medical center. This is a Changhua Christian Hospital. Our service population around 2.5 million. So if you've never been to Changhua Christian Hospital, welcome anytime. I will take you to visiting our hospital, and very beautiful place as well. Okay, so some introduction of the hospital. The hospital was founded in 1896. Now we have 9 branches. The total patient were around 4,000. So we also have built the first one of green and smart hospital. We call it Yuanling Christian Hospital in Taiwan. I will introduce that later. And so that one, we have very professional knowledge and technology in smart healthcare design, construction, and management. Share is our core value. So we are happy to share our knowledges and others with any of countries the partners, because this is a Christian hospital, so spiritual care is quite important for us, health promotion. And for me, I try to integrate any of the partnership from public and private and even university church to mobilize all of the resources to do our project. And we have the cooperation with Thai since 2010. Okay, so this is our green hospital, green smart hospital, including green part and smart parts. So that's the green part, including like the water, electricity, and the design of the building. And the smart part, we integrate any of the IoT technologies, AI, into the hospital management operation. So actually, the hospital comply with the ESG, that's environment, social, and governance for sustainable development. And what is the strategy for we working with the Thai? I think very important is we need to know the needs of the funder or donor. This is the government, because the funding is from government, and I also need to know the needs from the Thai. So for the government, of course, they would like the hospital to run their policy in the South Asian countries. And the other one is what is the needs from Thailand. So like the Dr. Akra said, that including maybe Thai 4.0, the policy, EEC, e-health, medical hub, precision medicine, regeneration medicine, whatever. And what is our resources we have? And so in our hospital, because we have to think about like what kind of knowledge, technology, human resources, we can do this project. So if I can comply with the 3 parts, maybe that's the first priority, the project we will choose. So from this one, we can see that the Thai needs mostly, they will be digitalized. We also say that's a digitalization or digital health. So in John Christian Hospital, working with Thai, we start from like a smart healthcare. Now we have the precision medicine and regeneration medicine as well. So what's the role of John Christian Hospital? I think that we are a hospital. We are not the medical devices company, so we didn't sell the product in the country, but our role is to try to bridge the vendor, the company in Taiwan, and the Thai in the Thai, maybe the hospital and or some of the companies. So our role is try to link to both of sides. One is to also comply with the government policy. So we use different kind of like inbound and outbound activities to try to play our role. So what is the inbound? That means we invite many of important like guests, hospitals, directors, and Thai, maybe the government, whatever possible to come to Taiwan. So like including the very professional training. This is training from 1 month to 1 year, depends on the professional their needs. So during when they come to Taiwan for training, we also invite them to different companies to introduce their products that's used in the hospital. Then let them know, okay, in the hospital, what kind of products we already use in the hospital, let them know. And we also invite some of very important management level, like directors or vice directors to come. But because they are very busy, so they will not really go on site to the clinic. So we arrange them to, majorly we arrange them to visit some of important companies that's working with us or join the international conference. Of course, we will invite them to join the Taiwan Health Plus Exposition, like today's that's exposition, and some of the exposition that's in the end of year that we call the Taiwan Health Plus Exposition. We will also invite them to join. And in outbound sites, we through different cooperation side MOU with the hospitals, universities, but we will follow up what is action we really do. So when we sign this one, we will invite them come, or if they have need any of consultation, they will through our department to do the further of the cooperation. And we also hosting different stations international conference. So since 2008 till last year, we already hosting 26 stations. Most of the stations, if the physical that will be in Thai, but during the COVID-19, we transformed all of the station into online style. Where's over there? Okay. We also do like the business matching for the companies. So because the company, as I mentioned, the hospital role, just like a bridge, we try to bridge Taiwan very good, excellent companies with Thai their hospitals. We try to build the connection and networking for them and try to promote Taiwan's company to Thailand. So we're hosting different kind of business matching, including the online business matching as well. Okay, so the other one is very important is we set up the demo site. The demo site is try to really let the Taiwan's product into the Thailand hospital. They can really use this one and get us some of feedback. So the feedback will go back to the companies that can modify their products. So the demo site strategy including like we try to modularize. That means not all of the demo sites had the same product. So in different hospitals, there will be maybe the different demo sites because that will be depends on their needs and the capacity. Also, that our companies, their different kind of devices, and how about their products, after sales services, extra. And we also consideration the regional because I don't want to put all of the demo sites in Bangkok area, for example. So we would try to, because Thai, like a elephant, so we try to have set up our demo site in different areas to balance the area needs. So and the other one, I try to diversify the products, not only the one same product to set up the demo site. So currently we have like the Thunburi Hospital demo site. This is a cooperation with Zhonghua Telecom and IMETech, and that I want to thank you for two of the companies. They put a lot of effort on this Smart World demo site. And the other one is telemedicine demo site in Overbrook Hospital in the north part in both area. We set up two sites. One is in Chinkong, the other one is in Mesai. So this is also working with the IMETech and Zhonghua Telecom. So thank you so much. And this is another part that we're working with another government foundation, government organization. They set up another demo site also in the north part area. This is in Chiang Mai Macromic Hospitals. This is more focusing on AI detection and stroke AI detection and emergency telemedicine. So some of successful cases for medical industry cooperation in Thai through the Java Christian Hospital. Actually, I think he is the speaker later. He will talk more about this one. IMETech actually, he joined this project. He joined our cooperation programs in 2018, and currently they have their branch in Thai and sell their products. And I hope that they can also play a business hub to introduce more of smart solution, in Thailand. Zhonghua Telecom Company, they are also very good of our partner, and they just like a list of healthcare as one of their priority in the marketing in Thailand. And the other one, like InvenTech or the V5 and technologies and a lot of companies, they have also very good results when they join this program. So I just highlight some of our achievements, including the MOU or some of the business mission or whatever extra for your reference. And so the future perspective, including we will continue to focusing on smart healthcare, telemedicine, precision medicine, regional management, and also the traditional medicine, because we have very good relationship with the Thai department or Thai traditional and alternative medicine departments. We're working with them majorly in the long-term and dementia care, because in Thai government, they would like to promote the Thai traditional medicine into the long-term care. And in this part of Taiwan, we have very good experience how to use Chinese medicine into the long-term care and dementia care. So Thai governments would like to working together to how to promote the Thai traditional medicine into the long-term care. So in this part, we'll continue to working with them. So the other one is we can also promote the clinic trial cooperation like with Rama or Sierra. And we have like the continue our training, including the professional training or study tour, in the medical business mention, And also we were hosting the international conference. So actually every year we are holding a big conference we call the Thailand and Thai Smart Healthcare Conference in Thailand. So this year we will continue to do this one. And of course we will continue to evaluate and set up different demo sites in Thailand. And we also do the mobile clinic in rural area. In this part, we're working with overbooked hospitals. So this is my presentation. I'm looking forward to working together. Thank you so much.
Thank you, Dr. Ninagao, for your sharing. Before we continue to the next speakers, please allow us a few moments to adjust the space on the stage so that our speaker can be more comfortable during the speak. Okay. And the next speakers will be Ms. Kamonwat Suksumek, Chief Executive Officer of HLab. Please welcome.
Good morning, ladies and gentlemen. My name is Khao Tu, my nickname. And here's my teammate, Mr. Pongsit. I am the CEO and founder of HLab company. We are a health tech company. We aim to re-engineer how healthcare operates by providing the data-driven hospital information management to improve the hospital process and leverage the clinical outcomes and also help optimize the resource in the hospital. So our intention for the hospital information system is not just the system to record, but the system to transform. And so far we have saved more than 19 million patient hours and also saved more than 42,000 medical personnel staff day. And so today we are here to talk about how we have managed to, oh sorry, the slide, okay. Oh sorry. Well, again, so here's just take a look of my data-driven hospital information systems, and yeah. Well, today we are here to talk about how we have managed to address one of the most severe issues in Thailand, and I think maybe the global problems, the staff shortage. Well, even though that Thailand can perform quite well among the many countries in the world, we still have some problems. In Thailand, there are 10,000 nurses graduating per year. And can you guess how many of them leave the systems in the first year after they just graduated? Can you guess how many percent? 10? 50? 20%? Do you have more than 20%? It seems like an auction. Well, surprisingly, 50% of fresh grad nurse quit in the first year. So that means 5,000 nurses leave the systems, and about 25 more after that. On average, 7,000 nurses leave the system each year. And do you know, not just the nurse problems, we got the problems of our new grad general practitioner or intern doctor. Yeah, the numbers. The new GP, the new grad GP doctors works 54 days a month. Not every doctors in Thailand. I mentioned only just new fresh grad doctors, the intern. If you work 8 hours a day, 5 days a week, that means we are working 40 hours a week and about 20 days a month, and they work like 54 days a month. And they have working more than like 48 hours non-stop. They often work like that, non-stop, which their decision-making ability is equal to a drunk person. It sounds bad, right? I just Google, not exactly Google. I asked ChatGPT yesterday. I have to admit that. I asked ChatGPT yesterday that how many doctors in Taiwan? It found out to be about 40,000 to 50,000 doctors in Taiwan, and they have to serve about 28.5 million populations. In Thailand, we have the same number of doctors, but they have to serve 70 million people. So I think it's quite hard. So the healthcare staff shortage issue is happening all over the world. And more than one of the papers said that more than 37% of doctors working 90 hours per week admit to make medical errors. And from the survey in 2019 in Thailand, asked about 1,000 doctors. 90% of medical errors occur due to insufficient rest. They can get enough sleep, and 15% may result in death. 8% may result in disabilities, and 30% result in longer length of stay of the hospital. So it's not just the medical staff who are lacking well-being, but we also harm our patient. But we might not realize it. So let me invite Mr. Pongsit
can I
to
join
talk
the stage?
about.
And actually,
Sure.
Yeah,
We can share the stage.
Yeah, Kun Kaman was trying to explain on the problems, but actually HLab trying to propose a solution. But before I move on into the solution, I would like to say how to get to be the smart cities or smart hospital if actually the patient will be impacted and not get the good health care. And actually more than about our patients, our healthcare staff also not get the work-life balance or the well-being that he will live for. So that's why HLab trying to propose the solutions. One thing before we move on, the healthcare system will be solved holistically, symmetrically by the government. Actually, Dr. Krapon just said about the solution. But HLab, as one of the company in our community to develop the healthcare system, we're trying to propose one of the solution to take care about our patients and our healthcare staff. This one is called our product that called Cortex chip, that actually is direct work to be the chip or scheduling management. This one is we not use only the data from the people and arrange it. And for sure, I cannot ask ChatGPT to arrange the scheduling. That's why I introduced the Cortex chip. We use the two things by using the innovation tag. On the left side, on the right here, we use the operation research principle, that kind of one of the AI, together with the multi-goal optimization. When we combine that two together, it's going to makes us to get the good scheduling for the staff. Okay, I will introduce you one by one on the detail of that. But before I move on, actually, when we're talking about scheduling is only one of the point when we manage the people. So when HLab look into the detail, we not look into only the workforce scheduling that in the middle of the system, but we also trying to look into the cycle that help us to be manage that dynamically. So starting from the demand and forecasting, for sure we have the data from the HIS, ERP, or maybe we start talking about the digital data hub from Ministry of Public Health. When we know that, we will foresee that how many demanding from the patient will be coming into our system, and actually we can forecast it. And after we forecasting it, we're trying to do the supply matching by arranging the staffing in each day, in each time, or each shift. And after that, we can use the AI, like the optimization goal, to be arranging the workforce scheduling, and then we can know the payroll, and then get the good pay for them. After that, when we know that, we will understand more over than the scheduling. We will know when the patient comes, which staff of the skill that lacking in our system. We can arrange the proper training and then developing the people to be solving the patient things. And at the end of the time of the dynamic cycle, as I mentioned to you, we expect to have the care outcome, service quality, resource utilization, and for sure, at the last, we will get the employee wellness or the well-being. Okay. This is the result. That's why we say the success story sharing to you. I would like to start from the left side here. This is the number that we already launched about 1 year of this contact ship. We save nurse about 1,200 man-day per year per hospital. We also reduced 25% of annual turnover rate when we already utilize in one hospital and tracking in 1 year. We can reduce 25%. Actually, somehow, if we're talking about in one department, when like about 10 staff, we can reduce the turnover rate about 1 people. It seems small numbers, but impact a lot because before we can training that kind of the nurse to be help us on the healthcare is very important. And we can save the labor costs per staff around 16%. That also help not only the MOPH, but also help the private hospital as well. And this is the result comparing with the normal manual by using the handwriting to be scheduling. You know, in Thailand, we have 900 hospitals and still use the hand and the paper to scheduling it. When we use the contact ship, one thing that I would like to point it to you is right here. This is the main important things. We not break any policy. That's why we save the 90,000 or more than 90,000 policy breaking rules already based on the contact ship that utilized in 1 year. This one is not only about the labor policies, including the hospital policy, that actually if you work 48 hours continuously, it seems like you're drunk. That's why the policy is so important. And also, when I would like to introduce you more, what is the AI that actually matching with the Ministry of Public Health target on the numbers 5, number 6 that Dr. Akarapon just mentioned it. We're trying to use the intelligence into that, not only normal scheduling. The first step, we try to use the AI for the demand and forecasting. You look into it, we have the data portions from the HIS, and then we were training it by monthly and yearly. And then when the AI understanding, we're testing it, and then we deploy it. And that's why this is a cycle. And then AI will learn and tell you about forecasting. You will know in Thailand, we have a lot of festival. I'm not sure in Taiwan. But actually, during the festival, we may need to demand that a lot because it's going to be a lot of people coming to our ER. That's why this one is so important for the demand and forecasting. And let AI help you because you don't know somehow when is it going to be happen for the maximum patient in our capacity. And for the scheduling, we also use the AI. That one kind of the things about optimization model. It seems so simple, but when we look into the policy, it's not so simple. And when we combine with the optimization target, also it's not so simple. The AI will be help you as well. I can guarantee to you that ChatGPT cannot help you as well as Kun Kamunwa just searched last night. This is just the normal step that I would like to show you. I think it's the time is constrained. This is so important for our contact ship. Can I move that a little bit? I cannot see the slide as well. Our contact ship can do not only the ship, that actually we can do the overlap pool. Because in Thailand, normally we try to do morning, afternoon, and night shift. But actually, our contact ship can do the overlap area or overlap time, can do the dynamic date and time. For example, we can set morning, afternoon, night, not only for the work day, we can set up for the holiday and vacation as well. Moreover than that, for staffing, we can set up more than about the multi-competency by not only call them like senior, but we can specific into like senior that have like the CPR trainings or EMS training into that to be make sure that we have the proper competency staff in our ship. And the last one is about policy. We can do about 82 points that can customize and configuration in our system. And lastly, I think this one is quite new. When I search around the world, we for sure we know have ship, staffing, and policy. But around the world don't have the goal. Because we know that when how to serve the people, what is called certification. That's why when we set up the goal, we consider 3 things that actually head nerds or the people that take care about scheduling can set up the goal in each month. That including, we would like to reduce the workload this month. That's why AI will be going to that direction. Or we would like to get the staff well-being for this month. Or we will try to respond every request for the holiday and the ship that they need to work on that day. That's why this one is going to be so important to be run in the AI as well. And this is the result that I told you about the literature review around the world. On the right side is our Cortex chip. It seems like I will tell you that our product is good, but I would like to compare point by point that actually we handle the staff more than 70, and actually we can do the overlap shipping more than 15 about the policy. And if you look into the request type, normally around the world only request the ship and the day off. But for us, we can request ship, day off, vacation, individual working preference, out of units. I would like to say on one thing, if you don't understand, if you're working in the private company in Thailand, somehow they also use the same doctor in the public hospital. But some people have to be on the ship, on the fixed ship on the hospital, in the private hospital. So that's why in our system can also manage the lock time that don't need to get the chip for the doctors, and then let them do the work for both of the public hospital and private hospital. That's why it seems that doctor do 2 works, right? But actually the main thing of that is that we can distribute the resource or the good people for the public hospital and private hospital that cover from the people around our country. And this is the last one that I told you. If we can point it out, which is the skill that we lack, and we know that what is the skill that we have to improve, we can direct to the HRD or the human resource development directly, and it should be help us to improve on the staff that we may require.
So lastly, what's our next move? As I mentioned earlier, we have to solve this complex system systematically and strategically, and you need data. By simply just using our software, we can identify where and when and which skill and which role that are in shortage. So without any need of the surveys or reporting system, because we can see the trend, we can forecast it. So the government can precisely plan when and where to train their staff and to rotate their staffs. And we also can expand it into a resource pooling platform that offers flexibilities in like managing staff, doctors, pharmacists, nurses to various areas to ensure the quality of patient care. And finally, we believe that our data-driven platform can pave the way to data-driven policy in very near future. And this is how we are going to change our healthcare system. Thank you.
Thank you, Ms. Kamonwat Suksumek and Mr. Pongsit Chong Reungra for your sharing. The next speaker will be Mr. Ken Yu, CEO of iMedTech. Please welcome Mr. Ken Yu on the stage.
Sawadee-krap. Good morning, everyone. This is my pleasure to share this presentation to you to make the health equality a reality through the telemedicine. So first of all, allow me to use a few slides to introduce ourselves first. Okay, we are enabler. We help hospital, we help caregiver to do the transformations. And we focus on the 3 vertical applications: the smart hospital, smart healthcare, and health promotions. When you mention about the transformation, which means result in provide better care, reduce the workload, and avoid the medical error. this is the transformation we are our different nation. And why I can stand here to share my experience, because we have done many successful cases in Taiwan. We learn many from Taiwan local caregivers. So many our customers are medical center or big hospital. So we build various applications in the hospital, like a smart operation room, smart ward, and telemedicine and ADC. So we try to use this successful case to duplicate to our Taiwan. So actually before COVID, we have done some cases in Thailand. And not only Thailand, in Malaysia, in Vietnam, and now recently we moved to Japan. So those are we finish the successful case in Taiwan first and duplicate it to our Taiwan. So before I go through my detailed slides, let me back to our main topic, health equality. I think health equality is the universal value. So all the government, they will put their resources to make it happen. But the tool, I think, is telemedicine. Telemedicine is a crucial element to make it happen. So I would like to share one video to you. We just finished this video a couple of days ago. So let me show this video to you first.
เราอยู่ในระดับรพสตถือว่าเป็นหน่วยบริการระดับปฐมภูมิซึ่งมีประชากรที่ดูแลรับผิดชอบขนาดใหญ่ผู้ป่วยทุกรายหรือใครที่มาขอคำแนะนำเวลาเข้ามาเนี่ยจะต้องมีการยืนยันตัวตนหลังจากนั้นเสร็จเราก็จะมีตั้งแต่ชั่งน้ำหนักวัดความดันวัดส่วนสูงทีนี้เนี่ยเนื่องจากว่าในอาคารของเราเนี่ยทั้งอุปกรณ์ต่างๆเนี่ยมันไม่ได้อยู่รวมกันมันอยู่แยกเป็นจุดๆที่วัดความดันโลหิตแบบสอดแขนก็อยู่จุดนึงชั่งน้ำหนักจุดนึงอย่างนั้นผู้มารับบริการมาเนี่ยก็จะเดินไปตามจุดต่างๆอาจจะเป็นปัญหาหนึ่งนะครับสำหรับในการตรวจสุขภาพของกับพี่น้องประชาชนที่มารับบริการที่หน่วยบริการของเราเอง
อุปกรณ์ทางการแพทย์นั้นก็มีไม่เพียงพอนะครับเครื่องวัดความดันเครื่องชั่งน้ำหนักส่วนสูงก็เสื่อมสภาพใช้งานไม่ได้
ในเรื่องบุคลากรเนี่ยคือน้อยมากซึ่งไม่เพียงพอต่อประชากรในพื้นที่ก็เลยต้องหาเทคโนโลยีอะไรที่ช่วยบุคลากรและให้ประชาชนเข้าถึงได้นะครับ
เครื่องตรวจสภาพอัตโนมัติตรงนี้ที่อบจ.ดำเนินการจัดซื้อมาให้นะเป็นครุภัณฑ์ทางการแพทย์มาให้เนี่ยมันเหมือนเขาเรียกว่า one stop service คือจบที่จุดเดียวมันในนั้นมันจะมีอุปกรณ์เครื่องวัดความดันชั่งน้ำหนักวัดส่วนสูงมีค่า BMI แล้วก็มีตรวจออกซิเจนจัดในตัวเสร็จหมดเลยแล้วก็มีการยืนยันตัวตนด้วยมันเลยทำให้เกิดความสะดวกและคล่องตัวสำหรับผู้มารับบริการในแต่ละรายเขาจบที่จุดเดียว
เป็นการอำนวยความสะดวกนะครับให้กับประชาชนในเรื่องของการรักษาพยาบาลเรื่องของการเบิกจ่ายตรงจากสปสช.เจ้าหน้าที่ก็เพียงแค่ส่งข้อมูลในระบบเข้าไปก็สามารถจะเบิกจ่ายได้แล้ว
ผลตอบรับดีมากเลยนะคะกับเครื่องคีย์ออสเครื่องนี้นะคะเพราะว่ามันใช้งานง่ายและสะดวกและรวดเร็วนะคะไม่ต้องเดินไปตามจุดต่างๆอย่างเช่นว่าชั่งน้ำหนักวัดส่วนสูงอะไรเงี้ยค่ะสามารถใช้ในเครื่องนี้ได้เลยในเครื่องเดียวเลยอะค่ะ
อบจ.เรามีแผนที่จะขยายไปให้กับหน่วยบริการอื่นๆทั้งนี้ทั้งนั้นเพื่ออะไรเพื่อเราต้องการที่จะยกระดับมาตรฐานการให้บริการในระดับรพสต.ให้มีมาตรฐานใกล้เคียงกับโรงพยาบาลใหญ่ๆของรัฐหรือแม้กระทั่งโรงพยาบาลเอกชนทั้งนี้ทั้งนั้นเพื่ออะไรเพื่อให้ประชาชนได้เข้าถึงและเกิดความเท่าเทียมกันในการรับการตรวจรักษาสุขภาพครับ
ก็คือว่าประชาชนได้เข้าถึงมากขึ้นนะครับและเป็นการพัฒนาศักยภาพบุคลากรผมในทางการแพทย์อะไรหลายๆอย่าง
ทางการยกระดับทางการแพทย์เนี่ยเราก็คุยกับผู้บริหารแล้วนะครับผู้บริหารก็มีนโยบายที่จะจัดซื้อเครื่องมือเครื่องใช้ที่อำนวยความสะดวกให้กับประชาชนแล้วก็ให้กับเจ้าหน้าที่ของรพสต.ปี 68-69 จะทำแผนเพิ่มก็จะให้ครบทุกพื้นที่ครับ
Okay, I think this is very good case to demonstrate how to use the AI technology to help the rural area to enhance their medical service. And so This is the typical system diagrams. We integrate the various medical devices to become the full function, vital station, desktop, home care, and even the mobile care. And all the vital sign data were connected to the cloud directly and exchange the data. Maybe follow the global standard file, the exchange the data with the Turkey customer, and the doctor remote side. The doctor just one click on the screen, you can do the telemedicine, consultation. So this is a IoT technology can help. And I would like to show more successful cases. Actually, Dr. Nina lead us to do many successful cases in Thailand. It's Dr. Nina just mentioned Overbrook. And maybe you know the Overbrook is located in the north of Thailand, in Chiang Rai. So their main hospital in Chiang Rai, and they have two small clinics near the border. So how to provide the same service quality in the border, near the border? Only use the technology can help. And last month, we just go to the McCormick to launch this telemedicine product and services. And right now, we are doing the internal training in the McCormick hospital. So I would like to share more telemedicine successful case out of Thailand for your reference. This is a very typical case, and actually our first case for the CCH. CCH, as Dr. Nina said, it is the biggest medical center in center of Taiwan, and they have many branch hospital in the rural area. So the branch hospital lack a caregiver as well. So they just put the device, the telemedicine device, in the emergency room. So the doctor in the emergency room, if they have some questions, they just one click. And then we are connected to the main hospital to invite a specialist to provide a better care for the patient in the rural area. This is a very good solution for CCH. And another case I would like to share is my partner in Japan. They are very smart. They use the standard 40 high container built with a mobile medical container. So the chairman told me, because of the very big earthquake in this January, they still have around 20 more containers right now stay in the Noto area to support their local medical service. So another case we just do last month in Nagasaki, the same applications. They have around 50,000 inhabitants in the small island near the Nagasaki main city, and they have one hospital, 5 doctors. Of course, they lack enough medical services. So we use the telemedicine to help them to bring the medical resources from Nagasaki University Hospital to the small island. This is I just joined this case last month. And the meaningful, this case, the meaningful is the communication, not use Wi-Fi, not use 4G or 5G, because it's a small island. They use the Starlink. They use the satellite communication. And I can tell you, we just spent 10 minutes to set up the satellite communication. It's amazing. In a small island, 10 minutes, we finish the satellite communication and help them to build a telemedicine. So, okay, this is my last slide. I think the health equality is not enough. We need to make the health equality come true through AIoT technology. Thank you. ขอบคุณครับ
Thank you, Mr. Ken Yu, for your presentation. The next speaker will be Mr. Jak Gosalayawat, Chief Executive Officer of PharmaSafe. Please welcome Mr. Jak.
Good morning, everyone. I'm Jak from PharmaSafe. Our keyword today is medication safety. In the US, every year, 70,000 people got injured by firearms. But you know what? 1.3 million people got injured by medication. How's it that? Medication errors such a big problem that affects millions of people around the world and costs billions of dollars every year from the healthcare system. The good money that we should put on something else that we need, you know. WHO tried to make a challenge 5 years ago for every country to reduce the medication errors by half in 5 years, but we didn't get any result of the attempt yet. In Thailand, 47% of the healthcare budget go to medication. It's about almost a half of it. And in a research, 40% of people who take medicine at home got the medication errors. It's like, you know, in Thailand we have 200 million prescriptions per year. That's the result of, you know, bad practice in medication for 140 prescriptions every year. And the problem is not going to be, you know, better because we are, you know, approach the aging society in Thailand, and people who have NCDs or older people who have to take medicine for the rest of their life got to, you know, consume more and more medicine. This real example of the errors from the healthcare system, that a patient can have, you know, duplicate medicine from, you know, they admit to the hospital, and when they discharge, they got, you know, prescribed duplicate medicines, same active ingredients but different brands. Or in certain medicine got contains some, you know, duplicate medicine like paracetamol is common errors in the healthcare system. And in Thailand, we don't have, you know, really big problem in accessibility of medication, but we have over, because right now we have universal coverage for 99.5%, meaning that all the Thai citizens can get, you know, free medication. So right now we can go to the pharmacies nearby our house and get free medicine. So at home we have so much medication. Pharmacists try to solve this problem by create a mobile application that connect to hospital system to send medication information, safety information to patients at home. And the system can inform the patients how to use the medicine correctly and reduce risk of the medication. Our system can send the identification of the medicine, like photos of the pills or packaging, and also the leaflets and other information that they need in their mobile phone automatically after they receive a prescription from the hospitals or care providers. And the system gonna remind the time to take medicine at the, you know, right dosage, and each meal easily on their mobile phone automatically. And the system can work with different care providers from between hospitals or pharmacies or other clinics that use our system, so we can prevent the risk of the drug-to-drug interactions or drug-to-disease interactions, and also like condition, pregnancy, lactation, that some cases cannot take some certain medicines. And we try to create the healthcare among the family or friends, so you can share your medication to, you know, families, and doctor can monitor the compliance and also your medication record through the system too. So the whole system is is creating a closed loop of medication management from the hospital to patient, and patient go back to the doctors. We work with more than 20 hospitals in Thailand, both public and private, and we also work with the PHR system in Thailand. The biggest one is more prompt, like doctor is ready to translate like literally. And in the Neurological Institute of Thailand, one of the specialist hospital, they test this system with epileptic seizure patient clinic and got the result of the compliance will be better for 40%. People take correct medicine and reduce the medication errors for 24%. And when we start the service 8 years ago, people say to us that, oh, older people wouldn't use the system, or in the rural area of Thailand, they wouldn't access to the mobile phone. And I think they are wrong, because people have their phone. They used to look at YouTube and other, TikTok clips, but they just, if we have the right tool that they want to use, they will, use it, and it's going to benefit themselves, even the older people, So what I believe to solve this problem, the technology is not enough. The tool that I create is just one part of the solution, but to create the patient adherence, which is the goal of care, we need to create solution at 3 parts of the body. The first one is at the head. Is the knowledge, communication. Doctors have to explain how to take medicine correctly. Pharmacists got to, communicate to the patient well, and they receive the, necessary information. And the second part is at the heart. All the patients, they have to have the motivation to, comply to the instructions or the suggestion of the care. So family have to support them, make the reason that why they should be healthier or why they have to take good care of their health. Empathy and love that people in the family and also the care providers got to, create the motivation for the patient. And lastly, at the hand, action. This part, the technology can come to help. Create the simple tool, the solution that easy to use and people understand and try to use it after they have the motivation. And if you look at the area of the solution, the first 2 parts is very important, and it's the human touch that technology cannot help. I doubt even AI couldn't help on this part. People still need the human touch, be able to motivate and support each other, and then they'll take action, and technology only do this part for you. So what I believe is my solution, my application is just one part of the solution, but to solve this medication error problem, we need to come together and work together, and we can make a difference and save millions of people. Okay, that's my presentation. Thank you, everyone.
Thank you, Mr. Jak, for your sharing. The next speaker will be Mr. Liu Xuanlong, Assistant Vice President, International Business Group of Zhonghua Telecom. Please welcome.
Hi, all distinguished guests. This is Liu Xuanlong from Zhonghua Telecom. It's my pleasure in here. I will try to share my experience, how we can export the smart healthcare solution to the overseas market Actually, we have some experience, and also we designed our strategy, how to prepare the smart healthcare solution in here, in Taiwan, and then how to launch the solutions in different markets. So, you know, from the previous presentation, Chunghwa Telecom, compared with all the speakers, we are totally different since we are telecom operator. So from the telecom operator point of view, how to export our solution, how to team the necessary team member to share or introduce the solution which is successfully happened in Taiwan to the overseas market is a total different thinking. So the following 10 minutes, I will try to have some information to all of you. Yeah. So here is the presentation topic. First of all, I have to say what Chunghwa Telecom it is. Yeah, you know, up to now, Chunghwa Telecom, as some operation revenue information, the total market cap from last year is around 28 billion US dollar. It's from the globally ranking, it's a number 22 for the telecom operator. And even our revenue on 2022 is around 7.8 billion US dollar. So you can see from the different domain as the broadband access or the mobile subscriber number, even the enterprise customer, we are ranking the number 1 in Taiwan. So next one, when we facing to export our smart healthcare solution to overseas, we should keep in mind to focus on the following key elements. Since we are the telecom operator, so we have different thinking. Yeah. So the following four items should be the most important element. The first one, you know, a lot of different medical solutions. So from the telecom operator point of view, only the service related with the connectivity is our major focus. Why? You know, telecom operator offering the connectivity services not only for the human being, but also for the different service application, including the medical healthcare related domain. So we just can focus on some connectivity related solution, which will be our target. For example, as just Ken Yu just mentioned, the telemedicine, or even the patient's smart patient room, or the smart medical cabinet, which this kind of different services just relies on the connectivity offering. That will be our target service. Next step is when we want to introduce our solution to overseas market, it should keep in mind, it's very, very important, those services should be proved successfully in Taiwan. So how can we build up an ecosystem, team together to offering this kind of services to overseas? It could be very important to build up the ecosystem. So you know, we have very strong relationship with the Dr. Nina and Ken. We are different domain, different company, right? So, but we team together, then we can build up very good and healthy and reliable solution to the overseas market. So how to build up the ecosystem could be the very important thing you should keep in mind. The third one is that you know, all solutions should be proved reliable and successful in Taiwan. Then we got the potential to export this solution to different overseas market. So it's also very important. The final one, you know, the smart healthcare or the different services introduced to our the hospital client right now getting more and more. You also should have one IoT platform to collect all necessary information or data generated by the different application services. And then from the hospital the client of the hospital, their point of view, they can aggregate this data into a useful information to support the following necessary operation or the final decision making. So how to apply the IoT platform could be very important. Since it's getting more and more complex. Yeah, when you introduce a lot of different medical services into the hospital. So the previous 4 points is very essential key point. When you prepare the necessary solution, try to export to the different country. Yeah. The following we were thinking about when we prepare the necessary service already, and then we want to launch in different overseas market, how we can launch this solution. Also, from our experience, there are 4 important steps. The first step, you should find the local kin. You know, in Taiwan, we are somebody, but in different area, we are familiar with the local market. So we don't know where our client, where our customer is. But if you have the relationship connect to the local partner, then you can got a chance to engage your client. So our experience, if you can cooperate with the local telecom operator or medical chain, even a large enterprise, it could be very good choice for the local partner. Since the local partner, they understand how to engage the final customer. The second one, also the services when introduced into the different market, you still have to thinking about the localization and customization. For example, the language adaptation or the regulation compliance. Even you should integrate with the local system or adapt the user experience in different areas. So when you take care and thinking about all these different localization or customization, then your services could be suitable for the different area. So it should also keep in mind. And then the third one is, you know, when you come into the unfamiliar market, you should build up the first pilot site. The first pilot site just is a right place to show your solution, to engage the potential customer, and then prove the solution is suitable for local. So how to build up the pilot site is also very critical step to is our experience. And then finally, based on our experience, you got a very successful pilot site established. The next step thinking, you should keep in mind how to build replicate the foreign business opportunity. So from one to end, how to replicate the the different, the potential could be very important. So in case we should keep in mind from the kind project can replicate to the vertical industry, or even from the domestic market can extend to the international market. It could be enlarge your opportunity in the, especially related with the medical healthcare domain. So it's our experience. Yeah, since we established the first point, the first pilot site in Tumpuli Hospital, then we expand to the Overbrook Hospital or to the Indonesia or Vietnam market, all just following the same thinking and the previous 4 steps to build up our overseas market. So finally, I want to invite all our partner. We can team together and build up our ecosystem by the good candidate solution we choose. Then we got a chance to export. And then when export our solution in different area, we should team together with the local kin partner and do necessary localization, customization to build up the pilot site and then replicate. Then everything could be happen. Yeah, if possible, we can team together. Thank you everybody. Thank you.
Thank you, Mr. Liu Xuanlong, for your sharing. The next speaker will be Mr. Nantapan Supapattarapong, Chief Executive Officer of Digital Health Hub. Please welcome.
Hello, good morning, everyone. Today, to be honored to be here to share about our experience in healthcare system in Thailand. I will share about some experience that could help improve patient quality of health in here. Okay, my name is Nantapan Supapattarapong. You can call me as a nickname as Note. Now I am a CEO of a Digital Health Hub, and we are the consulting firm in Thailand. We work several healthcare companies and pharma companies as a government partnership with to achieve the goal with the business. And in another hand, I have the advisor of the General Director of National Thailand Health Security Office, and to drive innovation or in reimbursement and drug system in Thailand. As a globally, trend of the digital health is increased significantly. Healthcare environment shift into the traditional way into the digitalization. Digital health to align with the sustainable development goal of the UN and comply with the WHO. As you see that the trend that shift from traditional way like a paper-based into the platform or digital platform already. About the volume of the market. For the global market size, will be reached out 510 billion in maybe next 2 years and growth almost 30%. For the globally, that accelerated by the COVID-19, as you know, that increased, accelerate the telemedicine and the telehealth. Even after the pandemic, we can see that new normal trend that healthcare continue to go up. For the Thailand, digital healthcare market in Thailand will be reached out into 1.4 billion in 2025. We expect around 90 million baht in this year. We growth almost 20%. The three key trend is, the first one is telehealth. The second one is IoT or wearable device. The third is low of the variance payer, some kind of doctor and healthcare system, ecosystem, payer and finance and logistics also. This is the first example or the first experience that we implement that the pilot project. We work together with the Ministry of Health or even like new startup to build and drive like digital health medical device and share information by digital platform. We have many key stakeholders, doctor, like a volunteer person and pharmacist and nurse and logistic for drug delivery for the first pilot. That's also that very important during the COVID-19 pandemic. After the COVID-19, we still to use this technology to manage NCD patient, the patient who have like controllable. This study that compared the result hypertension management between the pharmacist lead the health care on the like we have mobile to the home of the patient to record the medical record with the patient that compare with the critical practical in the normal ways. The result is we can use mobile or digital platform in the same way with we have the conventional way. This is paper from the American Heart Society. This is another report. Yes. The conclusion is telehealth by pharmacists is efficient and safe. This alternative to clinical-based way. That way, we can like parallel into in the first step, like a pilot that we can like after we complete with the first pilot, we can implement this program into the national level. However, that we have many key stakeholders in here. For the long term of the success of the technology, that depend on the multi-key stakeholder. One application cannot success if we don't have support on the several groups that I mentioned. That like regulation, payer, or our platform, we can like integration and also logistic. If we have comply all the key stakeholder, we can complete and we can move on from the trap list. In the part that we can like searching which hospital have experience on this area, that for now the people can search on the application or search on the website and can access into the like a telemedicine or telehealth and can deliver drugs when they sick at home. Oh, sorry. Okay. This is another example or another experience. The healthcare service expand to the digital location, especially on the NCD patient that who needs to refill medicine. And every month that during the COVID, people cannot entry in the hospital. We use this technology to connect with the hospital and pharmacy store and patient and payer to receive the medicine and drug at the drug store that near your home. And without the visit hospital. For the next step, we plan to deliver the drug to the home of the patient. We have to start the pilot project in Bangkok already. This data shows the number of the patient visits the community, like a common illness in the Thailand. In Thailand, we have a new policy. If people have like a common illness, you should like ID card showing to the drugstore, and you can give the medicine for free. For reimbursement is for all. This we pilot in the just 6 months, we have increased it 10 times. And the top of the common illness is like cold, fever, pain, and skin allergy. That's very simple. That people that should go to the hospital, right? That's like people can access the medicine easier. Okay. In the past, like financial. We have a bank balance. We go to pay the house, pay the everything. But for now, we can like ATM, and for now we have a mobile application. Health is same. Is the hospital is for now it's very busy in like a OPD, and now the pharmacist is very messy, and now telemedicine and pharmacist is very easy to our people. Okay, this our platform is help to depend pharmacy store and better manage the patient for develop to help the people increase the healthcare benefit on their mobile phone. They can choose the symptom and consult with the pharmacist online and get the medicine when they stay at home. Yes. Okay. Thank you.
Mr. Nantapan Supapattarapong for your sharing. And now our speakers have finished their speech, and we are going to move forward to the panel discussion. But before we continue, please allow our staff to adjust the space on the stage for the panel discussion. And may I inform our guests who will be joining the discussion that after your name is brought up, please come on the stage, and after that, we will take a group photo together. Then we will do the discussion. Now, 接下来我们即将进入论坛的环节，如果在场的贵宾有需要使用翻译机，那我们待会的论坛会使用英文来去进行。那如果你有需要使用翻译机的话，你可以用翻译机，然后切换到第2频道收听对不起，切换到1频道收听中文的翻译，谢谢。Ladies and gentlemen, please allow me to invite our guests to join our panelists, to join our discussion. Mr. Nantapan Supapattarapong, Chief Executive Officer of Digital Hub. Mr. Liu Xuanlong, Assistant Vice President, International Business Group, Zhonghua Telecom. Mr. Jack Gosalewat, Chief Executive Officer of PharmaSafe. Mr. Ken Yu, CEO of iMedTech. Ms. Kamonwat Suksumek, Chief Executive Officer of HLab. Dr. Nina Gao, CEO of Overseas Medical Mission Center, Changhua Christian Hospital. Dr. Akharapon Kurusatra, Assistant Director General of Department of Health Service Support, Ministry of Public Health. And our moderator today, Ms. Nishanan Tantrajin, Sales Manager of SEA Region iMedTech. 那在我们开始论坛之前，我们邀请所有贵宾在台上的，在比右手的大拇指跟我们的摄影师这边拍照。请问摄影师是在那边好？งั้นรบกวนท่านผู้มีเกียรติทุกท่านได้มองที่กล้องด้านหน้านะคะที่ตากล้องทางด้านนั้นเพื่อเก็บภาพเป็นที่ระลึกค่ะ ขอบคุณค่ะ谢谢 And I will now turn the program over to Ms. Nishanan Tantrajin. Thank you.
Okay, thank you for the stage. And today I'm going to be the moderator of this session. So we have around 23 minutes before we come to the end of this discussion. So yeah, we can quickly go to the topic today. So we have listened to a lot of interesting concepts and also the solution sharing from our guests today. So now let's discuss on the practical aspects. Let's dive down in the topic of opportunity first. For Taiwan and Thailand collaboration on healthcare, I would like you to share your idea, your opinion, or even the case studies toward this topic of the collaboration between these two countries. Let's begin with the opportunity topic first. Maybe Dr. Nina, you can start. Oh, okay.
For me, I think I will be the last one. It's okay, because you will be the final make what is the challenge, opportunities to collaboration. It's up to you because the business sector first. Okay.
Okay, I'm first. I think it's really good opportunity that we have to join this seminar. In the past 2 or 3 years, we have a lot of the new opportunity and partner. We found that the exhibition, and we have there's someone that I found that is I'm not sure that Taiwan hospital or not, that they have the management system that can control about the human error when the pharmacist they prepare the medicine to the patient. They have a RFID or the QR code, something like that can pop up and unlock the table or the shelf that the medicine that should be have a doctor prescription. That I think that really good technology that it will comply in our country. I think that help a lot that in time something that a rural area that we don't have a pharmacist. If we have the system, we can should help the people and help the HCP is very good. It's fun one.
Okay, I think that for the opportunity, we can think about from different dimensions. The first one, I think because the government, they support the program. Because now currently the government, they are promotion of Taiwan and Thai cooperation. So government will give us more of supporting. This is very important for hospital and for the companies because they are supporting by the government. Of course, in the hospital side, we have some funding to support the companies to go to Thai to do their business and the cooperation. Second one is actually I know that Thailand, they are more to, how to listen one, the digitalization for healthcare is their very top priority. And in this part, also the strength of the Taiwan companies. So not only the hospital, not also of the companies in Taiwan, because Taiwan has IT and the in other medical devices quite good. And I think this is one of the opportunity for Taiwan companies when they would like to do the business in Thailand. Just like I mentioned, that automatic cabinets, this is in Taiwan, it's just like a very mature product. And currently we also to start to promote in Thailand. So in this year, we were going to set up one demo site in Hua Chiao Hospital. So I think this is another part so that we can working together in the future. And what is the challenge? The challenge is, I think that if we want to promote a product in another country, the first one, you have to know the regulation, right? So I think that your product not only be very good, but you have to comply with the regulation of the country. So your product, if you can pass like the United States FDA, of course you have to pass Thai FDA first, Taiwan FDA first, right? But if you can have like a license like United States FDA or EC, that will be more easy for you to go into Thailand, but you also maybe to pass a Thai FDA. So this is one of very important parts and the challenge, because it maybe take time. You need to do a clinical trial, you need to apply for the regulations. So I think this is some of the challenges for the companies. The second challenge, I think that's the maintenance, because for most of product, they say in Thai, but the first question usually asked from the hospital, they will ask, how is maintenance? So I think for the company in Taiwan, if you think about that you want to sell your product in Thailand, you need to also think about how to do the after-sales services. I think that's also very important, the issues. So this is my opinions.
Thank you. Mr. Liu, do you have anything to share about opportunity?
Okay. I think totally Chunghwa Telecom is a different role when we want to engage the potential opportunity. So we offering the connectivity solution. So totally, I think we just play as the system integrator. So what kinds of the solution is suitable for the different area? For example, is successful in Taiwan, we try to introduce to Thailand. And then we do our best offering the connectivity infrastructure to play a good platform for all the services implement and launch, even located in Thailand. It's our job and our responsibility. By the way, we still have some experience when we facing in Taiwan. It's a Taiwan government right now. They just want to introduce the new version HIS architecture. I think it's a totally different thinking. Yeah, it's a new architecture and tech different domain information can merge into one very solid system in architecture. So that's our opinion. Maybe Thai government or Thai medical industry also should prepare in advance, thinking how about how to introduce the new version, HIS version 2 can introduce in Thailand. Yeah, you know it's a good architecture, can prepare everything, can management all the information inside. Yeah, if got possible, I think also it could be helpful for the foreign medical industry in Thailand. It's my suggestion. Thank you.
Thank you. Okay, so Ms. Kirwan.
Well, for me, in the big picture, I think Asia Asia is is kind of a big deal in economy, especially in health economies. So the collaboration Thailand and Taiwan is going to make a big impact on this economy as well. I think if we take a look of our strength of each country, I think Thailand, the government did a great job on how to manage very limited resources, but still can provide good accessibilities, good healthcare, good coverage, health coverage to every single people in Thailand. So for me, as a health tech company, I think we are specialized in how to help managing the healthcare resources, how to optimize these very limited resources. And I think this is Thailand's strength, the healthcare efficiency, the healthcare accessibilities, and healthcare hospitalities. So I think this is a strength of Thailand healthcare systems. I have to admit that I didn't know much about Taiwan healthcare, but I think the infrastructure, IT, tech workforce in Taiwan is very strong. I think we can find a way to collaborate for capacity building between Thailand and Taiwan. Thank you.
Yeah. I think Mr. Ken have a lot of experience in the collaboration.
Okay.
Have any words?
Yeah. Okay, thank you. And so when we're talking about a business, I think it's quite different between Thailand and Taiwan. And I think the most difference one is in Taiwan. Taiwan's hospital mainly take care of 20 million more people in small island. But as I know, the hospital in Thailand, they aim at all people in the world. And they treat the business, they treat the medical as a business. They even allow the hospital can IPO in the capital market. This is cannot imagine in Taiwan. And if you know the difference, so you know the different markets, they have different mindset when you would like to use the technology. That's why we would like to duplicate our solution in Taiwan to Thailand, just focus on telemedicine, smart OR, smart ward, and ADC, because they will help provide a better care and avoid a medical error. And the hospital in Thailand, they will consider the ROI because this is a business. They are a listed company. They need to calculate the ROI. So that's why we choose some mature solution from Taiwan to Thailand. Yeah.
Okay. And Mr. Karapon, I think maybe you can have some idea to wrap up this topic on opportunity.
Thank you so much. Because the policy in Thailand is health for wealth. Just only 3 words. Health for wealth. This is a keyword that you will make any opportunities in Thailand. About the digitalization, the roadmap, and the final framework, we want about the 4 keywords. And one is e-health. 2 is M is mobile health. 3 is T or telehealth. And the final one is AI health. So if your company can create about the ecosystem, you'll be great. The slide before I sent to you, but I never talked before. You know how many visits of the OP visit in the hospital in Thailand? I talked to Mr. Ken already. 350 million visits per year. 35 million visits for a month. For 66 million population. For one man visit hospital for 5.1 times for a year. Now we change the policy also. At that time we have referral system. And now we will change to be no referral system as Taiwan. We will learn from Taiwan. Wherever, whenever, You see, if we not create about the ecosystem just like the tele or any issue of digitalized, may be overcrowded at the Excellence Center Hospital. Mostly they don't go to the sub-district hospital. We urge them to go, but they want to go to see specialists as Taiwan. It is opportunities. So how the cooperation of the opportunity? I think 3 points. The key point number 1 is we will have a joint operation of the transfer of the knowledge of the manpower, but because Taiwan is the very good example in the world, because we have the shortage of digital health manpower in Thailand. So it is easy to weigh the first step. And the second, we have the problem of cybersecurity a lot. If you have any to protect, government have to inject about the finance, about the cybersecurity, not only the private. Private, they just wet, but this is the duty of the government to inject the finance. And the final is we will learn together to bring about the mobile health, telehealth, and AI health. The shortage of time, we will learn from the leader of the world as Taiwan. And then just not only use Thailand for the hub and there. Please transfer knowledge. We will win together. We will win together. Thank you.
Thank you so much for your wrap up on this topic. So we have talked about the opportunity which is already there, right? In another way around, I think it will be very interesting to discuss about the challenge or some obstacle that we are still facing. Dr. Nina have shared a little bit of challenge in the previous questions before. So I would like to hear from another guests here about your idea on this topic. So who would like? Okay, maybe Mr. Ken can start.
Yeah. So talking about challenge, not only in Thailand and Taiwan, I think a challenge everywhere. Yeah. So as a Taiwanese company, actually we have, I guess, the best ICT technology and the best IT resources in the world. So, but when we use the technology into the medical sector, we need to translate it to be a clinical value. It means we don't need to expand the IT spec to the caregiver. We need to expand the value we will bring in. Don't talk about the technology. I think they will love the result we believe in. This is first thing. And second thing, I think how to help caregiver to use your solution is very important. And because most of the caregiver are not technology savvy, no. So we need to consider about the good UI UX design. We need to consider about the localization and provide more training course for them. And it will help you to land your solution in the hospital smoothly. This is our experience. Yeah.
Okay. All right. Maybe Ms. Kumon, you can share from your business aspect about the challenge, maybe what you have experienced.
Okay. If in terms of we have a business about the challenging, I think we have 2 things. The first one is about the regulation. If we say about the technology or something like the new era, how the regulation is complied with our current practicals. The second thing is very important about I think it's important for all of this about the budget or investment. If we start to create the new thing that impact every people, I think we should have think about the investment or the resources that we have. If we should have the investment that we have set the properly that should be going up together with the startup like us. Yes.
How about Mr. Liu? Do you have anything to share?
I think I have still mention that we are the telecom operator. So from our point of view, right now the introduce for the smart healthcare and etc. services into the hospital client is getting more and more. But actually the insight of the different services is very important, especially all the insight, if possible, can aggregate together, could generate more useful information. It means at this moment, how to introduce the platform, which got the capability to aggregate different information from different devices, even from different solutions, could be very, very important for us. So the IoT platform, due to it can aggregate all the various medical devices, and finally all the necessary information can put on the same. It's a unified dashboard, can show necessary information. When we got this useful information, then finally the following hospital operation or different services operation could get the supporting from the inside data. So it's very, very important. So it's our duty, if possible, we can introduce the necessary and very important IoT platform into the operations. Actually it's an ecosystem cycle. Yeah, if we can introduce the IoT platform inside, it could it's useful and got very potential in the near future. Yeah, it's my point. Yeah, thank you.
Thank you. Maybe Ms. Moon.
Me? I've just read the report that the Singapore government spends 6% of their GDP to just digital health. 6% of GDP is quite a lot. So I think the investment, as you mentioned before, is very important for the infrastructure, startups, and the hospital to that they can afford to buy or to use the technology to help expand their services to take care of their patients. So I think the very important part is the investment from the governments. And the second part, I think, is standard legislations. Dr. Agapon mentioned that right now Thai governments had just launched many standard to provide all the private and the public sector of health IT to develop and set the bar. I think it's going to have to be a lot more of the standards, such as the health informatics standard that helps HIS, all the applications, IoT that can seamlessly integrate it, and that can leverage the quality of care of the patients a lot. So I think this is very important. And the challenge number 3, from my point of view, is Thailand has a shortage of IT manpower. I have my own company. We have about 70 IT guys in my companies. So rare. I would struggle to find these guys, 70 guys. But I just talked to Dr. Nina. And you said that one hospital has 70 IT in their departments. I was so surprised. I can't even get there. So I think, in my opinion, one of the big challenge of Thailand to go overseas is IT manpower. So I think working or collaborating with Taiwan will bring a lot more opportunities.
Can I add something about this?
Sure.
Yeah, I think that not only in Taiwan, we also shortage of IT talent. Yeah, most of the IT talent they would like to go to, like the that's not go to the hospital. So we do another. Okay, the other question is the pure IT. They cannot understand the doctor's language. So in our hospital, we're working with the university. We open like an AI school. We encourage the medical personnel, like the nurse, doctors, to learn more of IT languages, and they can help that really IT guys to design the program and to reduce the gap, the language gap, because the IT they're thinking and the doctors their needs usually they cannot, to match. So they need to spend a lot of time to modify the program. So if the doctors can learn the AI or the IT or technology, the knowledges, they can reduce the gap. So in our hospital, our director of IT department is a doctor.
One sentence, I will feedback to Dr. Nina. One IT guy just graduated from university. When you go to hospital or go to semiconductor, they can get a full-time salary. So it's a very big challenge. Yeah, very big challenge.
Our both big challenges. In my company, I have a doctor who is a programmer himself. So because, as you said, an IT guy have to understand very deeply about how healthcare works. So they left. Yeah.
Okay, so Dr. Krapon, you have any final words to share?
Give an answer.
Thank you so much. Because I think I answered already, because challenge have the 6th challenge of the Thailand. But the number 1 and number 2 is the government sector. But Thailand do have to solve it by themselves. But other, we can go together. It's meanwhile, government is not only the control, just like the ego. If I am the ego and not come here today, we want to be about the supporter as the pigeon. So if you want to think that you will go to Thailand to partnership, now the government is thinking just only the health for wealth. If wealth, we wealth together. So 3 paths, I think the challenge is the easy way. Okay, number 1, I think, please set up about the seminar of the smart healthcare solution together with Thai and Taiwan together. Just managed by Ministry of Public Health. You stage at there. Stage at there. I will be the cooperation about it. I totally understand. The first time, I just think only one night I will come or not. Only one night. They asked me for many times, 10 times, 20 times. Boss, you have to answer. Why I can't answer? Because I not read anything that you writing to me. It's been why I here for 3 days. And the second, I think, how many IT in healthcare in Thailand needs, you know? We need about 8,000. Just so create about the ecosystem together, to transfer together, to know, to sharing with university together, or any college together. It is can go together. It is a challenge. And the final, if there any company in Taiwan can make about the conceptual framework that I talked before, we will get it. In Thailand, we spend only about the budget for the health outcome, only 5% of GDP. It's very, very low if compared with the health outcome that we have. Very, very low for the health outcome. But why we have good health outcome, but only in 5% of GDP? But in the medical hub, if you are one driving engine together with us, to be about again to boost the GDP income, we talk with the government that we will boost about 2% of GDP with the medical hub policy. If Taiwan will be one joint together to boost up the GDP in the region of the Thailand. You will be one that we will select.
All right, so thank you once again for your eye-opening sharing today. And with the interest of time, I need to cut the discussion today. So I would like to pass back the stage to the MC.
Thank you. And this is the panel discussion for today. But before we finish the activities, I would like to invite all the guests to take a group photo once more, and also I would like to invite Mr. Jakko Saryawat to join our group photo again. Thank you. Thank you. And thank you to all the panelists for your participation in the panel discussion today. And also thank you, Ms. Nishanan, for being the moderator. And with that, we now conclude the Taiwan-Thailand Smart City Forum, Smart Healthcare. Thank you for all of you to join us this morning. And we also thank you, all of our speakers, to join and share their expertise and insights with our audience. We hope you all enjoyed the event. Thank you and goodbye. สวัสดีค่ะ